Folks, today is Friday, December 11th, and a few updates for today. Number one, I'm sure you all know the case counts, positive case counts in New Hampshire are rising. We are starting to see that within our own communities. So we do weekly surveillance testing of our healthcare staff, and in some cases, our healthcare residents. And this week that surveillance testing yielded no positive cases at our Birch Hill campus, which is great, but 5 positive cases of staff at our Exeter campus and 2 in Durham. All staff and folks who either had no symptoms or very light symptoms, where if we didn't do the surveillance testing, we wouldn't know. So it's great that we know. The staff members can go home and quarantine and stay safe. But a few things come from that. One is it's our expectation that we will continue to have positive cases in the surveillance testing for a while, because the virus is just kind of running rampant through New Hampshire right now. And secondly, what we want you all to know is look out for updates from your executive director, because our operations get impacted not just by folks who test positive, but also folks who might have to stay home and quarantine because a family member tests positive or they have exposure in some other way. So we're always going to make those decisions about quarantining based on your health and safety and our staff's health and safety, but it does run the risk of impacting our ability to have really normal operations on any given day. So that will vary campus to campus, community to community. So look for input from your executive director on that. Related to the rising case counts, we are implementing a new quarantine policy, and that's just designed to try to keep you and our staff members safe. And that is, if you travel overnight between now and the end of January, when we know the holiday season is here, you will have to quarantine for 10 days. The only exception to that would be if you're going from here to your own home. So if you have a lake house or a mountain house and just you and your spouse or just you alone, then you wouldn't have to quarantine. But if anyone else is there with you, you do. So that's number one in terms of quarantine. Number two is if you attend a gathering of more than 6 people who are not you or you and your spouse, then you'll have to quarantine. And then lastly, if you are at a gathering with folks who have come from outside of New England, either by public transportation or if they've come from outside of New England, even in their own car if they've not quarantined, then you'll have to quarantine. So that's all in today's memo. The last part is, I know it's the holiday season and we want to gather together, but now is not the time for our communal dining to be open. And so we will not do that for the holiday season coming up. I'm sure your dining departments will prepare festive and fun and delicious meals for the holidays, but we will deliver them in the way we have been the last several months. We will not open the communal dining rooms. The good news, however, but always some good news, is that a vaccine has come. We expect that the Pfizer vaccine, which is an mRNA vaccine, will be approved tomorrow or Sunday. It is our understanding that the Pfizer vaccine is at least what we'll be receiving at one of our campuses. And our vaccine delivery will happen through CVS. They will handle all the administration. We will handle consent forms and logistics. But it's great that CVS will handle this. Our healthcare staff and our healthcare residents will be in phase 1A. We expect that will happen before the end of the year for the first shot for at least one community, and right around the beginning of the year for the other 2. And that's great news. We've been waiting for science to catch up, and it is. What else we know? We have our expectation is that you as independent living residents will be able to receive the vaccine in phase 1B. And while I don't know exact timing yet, The guidance we've received is that will happen shortly thereafter. So we will keep you updated. We'll continue to provide you with whatever information we can about the vaccine. And until then, stay safe, wash your hands, wear your mask, and keep your distance. This is, the vaccines are coming, safety is coming, better things are coming, and we just all have to stay safe and healthy until then. So with that, sign off for tonight.